All right, let's get right into it. We're going to tackle a really big question in healthcare today. What's the secret sauce that makes modern nursing so effective? And here's a hint. It's not just about compassion or years of experience. It's about science. We're going to explore why solid scientific research is now at the very heart of everything nurses do. So think about this for a second. Imagine you or someone you love is in the hospital. What do you assume is guiding the care you're getting? Is it just based on the way things have always been done? Or is it something a little more rigorous? It's a question that honestly has a huge impact on how well you're taken care of. For a really long time, a lot of nursing was basically guided by tradition. You could call them rituals, things just passed down from one generation of nurses to the next. But let's be real, in today's super complex healthcare world where the stakes are just incredibly high, that's just not going to cut it anymore. The modern way is a total shift. We're moving away from ritual and towards results. It's all about care that's based on hard scientific evidence that tells us what actually works best. Okay, so here's our game plan. We'll kick things off with the big challenges facing healthcare today. Then we'll see how research makes care way safer. After that, we'll talk about how it actually validates nursing as a profession, how it proves its value to the whole system. And finally, we'll get into its incredible power to predict and even control patient outcomes. So, what's really pushing this massive change? Well, the simple answer is that healthcare today is just insanely complex, and it's changing faster than ever. Trying to rely on old traditions or just intuition and common sense in a world like this, it's honestly just too risky. We absolutely need a stronger, more reliable foundation for taking care of patients. And that foundation, you guessed it, is nursing research. Now, this isn't just about people in white coats in a lab. As you can see from this definition, it's a really formal, systematic way to develop trustworthy evidence. And that evidence covers everything, from what happens at the bedside to how we educate nurses to how a hospital is run. This is the engine that both checks our existing knowledge and finds brand new, life-saving answers. So let's talk about why all this research is so important. What does it actually do for what matters most? You, the patient. Well, the number one goal of all this work is to make sure you get the safest, most effective care there is. It's about moving from guessing to knowing. And this is where it all comes together in a concept called evidence-based practice, or EBP for short. Now, this isn't about a nurse just blindly following a research paper. A better way to think about it is like a three-legged stool. It's the perfect blend of the best scientific evidence out there, the nurse's own hands-on clinical expertise, and, this part is just as crucial, your personal values and preferences as the patient. So here's how that actually plays out. First, a nurse has to critically look at all the available research. Then, they blend that evidence with their own experience and, really importantly, what the patient actually wants. And only then do they use that powerful combination to make the best clinical decision, all with one goal in mind: making your outcome better. And does this process actually work? Oh yeah. A major meta-analysis, that's a study of studies, found that patients who received care guided by EBP had 28% better outcomes. I mean, think about that. That's not a tiny little improvement. It's a massive data-proven jump in the quality of care. It's a huge deal. Let's look at a really powerful, real-world example. For decades, the tradition, the common advice, was to put babies to sleep on their stomachs. It just seemed like common sense. But nursing and medical research took a hard, systematic look at SIDS and discovered the complete opposite was true. Putting babies on their backs to sleep was way, way safer. That one research-driven change in practice has saved an incredible number of lives. Now, beyond keeping individual patients safe, this research does something else that's absolutely critical. It validates nursing as a true scientific profession in its own right. It gives the entire field its credibility and authority. You see, in the early days, a lot of nursing knowledge was kind of borrowed from other fields, like medicine or sociology. But through its own research, nursing has been able to build a distinct body of knowledge that's all its own. This is what defines the unique impact that professional nursing care has on patients. It establishes nursing as its own science. And why does that matter so much? Well, if you look at what makes any field a respected profession, having its own established knowledge base is right there at the top of the list. It's the bedrock for everything else, for professional autonomy, for setting high standards, for earning public trust, and for real accountability. And that accountability, well, it goes all the way up to the entire healthcare system. nursing research doesn't just impact a patient's health, it has a huge effect on the financial health of our hospitals and our clinics. Research is what gives us the hard data to prove nursing's worth to the people holding the purse strings, the administrators and policymakers. Studies can actually show how specific nursing actions reduce how long people stay in the hospital, prevent really expensive complications like infections, and help hospitals staff themselves more smartly. It's how nurses can prove their value in dollars and cents, not just in compassion. This quote just nails the modern reality, doesn't it? Healthcare is all about accountability, and research gives nurses the evidence they need to answer every single one of those questions, to justify what they do, why they do it, the results they get, and what it costs. So finally, let's look at the real power behind this whole scientific process. It's not just about finding out what works. It's about a sophisticated journey that takes us from simply observing something all the way to actively controlling patient outcomes for the better. There are basically 4 big goals here. It all starts with description, just trying to identify and understand what's going on. Then comes explanation, figuring out the why, the cause and effect. Once you can explain it, you can move to prediction, forecasting the chances of a certain outcome. And the ultimate goal? That's control, using all that knowledge to step in and produce a positive result on purpose. Here's a perfect example of prediction and control in action. Through a ton of research, nurses have developed these really accurate assessment scales that can predict a patient's risk of getting painful pressure ulcers. So by knowing that risk ahead of time, they can take control. They can put specific preventative measures in place so that the ulcer hopefully never even develops. That's proactive, not reactive care. So there you have it. From the bedside to the boardroom, nursing research is the engine that's pushing patient care to new heights. It's all about a commitment to move away from, well, this is how we've always done it, and move towards, this is what the evidence proves is best. And that's what makes care safer, more effective, and always getting better. Which really leaves us with one final big question. What's the next major healthcare challenge that we need this kind of science to solve?